Alberta doctors say their SOS to the province has been heard, but they're still waiting for a rescue.
We actually need action and investment now.
For months, the Alberta Medical Association has been asking the province to pay for improvements. In December, they delivered an acute care stabilization plan. Last month, they raised an alarm about a rise in surgical diversions, and they've been trying to get a bump in family doctor pay since the government imposed changes in 2020. The AMA says it's $32 a visit.
It's to the point now where they can't pay their overhead staff. They can't actually make that model work. People pay more for a haircut than a family doc gets paid to see a sick patient in their office these days.
But there is a bright spot. The AMA's president says a deal has been reached with Alberta, which would see family care clinics get a boost of about $100,000 a year, roughly 20% more. There are still no dates, however, for when that agreement will be formally announced or take effect.
We have almost, in the neighborhood of 800,000 to almost 1 million Albertans do not have a family physician. That's beyond an SOS crisis. And we're going to lose the family physicians we have right now if we don't do something immediately.
A spokesperson for the health minister says the family doctor agreement is still being finalized and details will be released as soon as possible. The province is also working with the AMA on acute care stabilization, but the good news, the spokesperson said, is Alberta now has 500 more registered physicians than it did last spring. Doctors are also concerned about this fall and winter and the system's ability to handle seasonal illnesses. Their proposal from last winter includes more pay to attract and retain doctors. From Edmonton, Sean Amato, City News.